Then fatty liver. Fatty liver, guys, is super important. Fatty liver is super important, not only for the SCA, is important for the AKT, is important for your daily practice. It's a very common, very, very common case. Usually, how it present, someone who had some blood test, and then we have found that ALT is high on the blood test. So we repeated the blood test again, we find ALT is still high. Nothing else, just ALT is high. Or someone who had already high ALT on a few occasions, we done ultrasound scan, ultrasound showed that there is fatty infiltration of the liver. So it can present in either way, either blood test only or blood test plus ultrasound scan. Then they are coming to discuss the blood test results or the blood test plus or minus ultrasound scan. Before we start, okay, you need to be aware what is the difference between alcoholic and non-alcoholic fatty liver disease. Alcoholic fatty liver disease, usually it comes AST is higher than ALT. Mainly AST would be higher than ALT. In non-alcoholic, ALT is higher than AST. Mainly ALT is high. In alcoholic, mainly AST is high. Also in alcoholic fatty liver disease, you will find also GGT usually high, macrocytosis or high MCV on the full blood count. What is the trick here? Maybe the patient is having ALT, however, he is still drinking alcohol, or he is drinking some alcohol every week. If he doesn't have the full blood picture for alcoholic liver disease, so it is mainly still non-alcoholic fatty liver disease, even if he still drinks some alcohol. For example, if normal GGT, there is no macrocytosis, AST is not that much high, mainly ALT is the one which is abnormal, So mainly it is alcoholic fatty liver, non-alcoholic fatty liver disease, non-alcoholic fatty liver disease. Very important. Especially if he is drinking with a reasonable amount of alcohol, less than 14 minutes a week. So fatty liver, what is the questions or what are the questions you need to ask, guys? As we mentioned, either blood test or blood test plus or minus ultrasound scan results. So why you have your blood test done? Do you have any symptoms at all? Any stomach pain, any fever, any vomiting? Ask about acute hepatitis symptoms like abdominal pain, fever, vomiting. You can ask about any yellow skin, any yellowish discoloration of your eye, any pale stool, any dark urine, any recent illness or any recent infection or any recent flu-like symptoms or gastroenteritis symptoms, any swelling in the legs, any puffiness or any swelling around your face, if there is any edema. Any vomiting? If yes, any vomiting of blood. Ask about cancer symptoms. Also ask about any recent travel abroad, any previous history of liver infection like hepatitis, any previous blood transfusion, any previous needle stick or tattoos. Family history of any fatty liver, family history of liver disease. Social history is very important. Don't forget to ask about lifestyle habits, smoking, alcohol, exercise, what kind of diet, physical activity, all of that. Very important. Also, don't forget any history of any drug abuse, IV drug abuse. Okay. Definitely eyes and impact. How you can explain your blood test, your ultrasound scan showed a fatty liver, which means excess fat has built up in your liver. It is very common and often linked to our daily habits like diet, weight, diabetes, alcohol use. While it is usually not serious, if unfortunately left unchecked and we didn't act on this, it can lead to liver damage over time. The good thing or the good news, we pick this up early without or before it led to liver damage. Okay, but if we didn't treat it on time, if we didn't take precautions, if we didn't do some adjustment in the lifestyle, I'm afraid that with time it can cause liver damage and liver scarring. So the good news is with some lifestyle changes, for example, improving diet, increasing your exercise, managing any underlying condition can help reverse or prevent further progression to liver damage and liver scarring. How you manage this case? If he was not examined by any medical professional or any advanced nurse practitioner or any medical colleagues, you need to offer face-to-face, and you need to explain why. I will examine your abdomen, check your heart, your weight, your height, your blood pressure. Fatty liver usually or sometimes it is a part of metabolic syndrome. So we need to make sure he doesn't have any high blood pressure, heart sounds are okay, what is his BMI, all of that. Then we can do a liver screen because there is abnormal liver functions, persistent or going for some time. Hepatitis screen, HIV, autoimmune. Don't forget, guys, lipid profile. Lipid profile is very important. HbA1c is very important, and protein screen as well. FIB4, and explain what is FIB4. We will come what is FIB4, how you can explain FIB4 to the patient, because we need to assess his risk of having or progression of his fatty liver to liver cirrhosis. His risk of having liver cirrhosis. So FIB4 will come. So please explain FIB4. If FIB4 came back high, we will refer him for fibroscan. Fibroscan is a painless scan like ultrasound or gel scan that it checks your liver stiffness to assess for scarring, liver scarring. Refer him if needed if he's having high FIB score, because if he's having high FIB score, he needs to be under secondary care. If FIB score for him is low, we can manage in the primary care by annual follow-up. Self-help measures, usually lifestyle advice, and here comes the shared management plan. What he can do, self-help measures. What you can do at a GP, we will keep on his blood test results, especially liver function test. We can refer him if needed, arrange more investigations if needed, and definitely face-to-face as well. Q risk is important because it can be a part of metabolic syndrome. Routine follow-up, very important, especially if he's having low FIB score. Definitely optimize his blood pressure, diabetes, all of that. Charities to signpost to or resources, British Liver Trust or Liver for Life. Again, as we mentioned before, any charity you would like to explain to the patient in the exam, we'll send you a link to our website for charity that will explain to you what is fatty liver, what are the causes for fatty liver, risks or future risks for fatty liver, how we can improve your liver function, how can we avoid having liver scarring in the future, when you should seek urgent medical advice. Okay, safety net about jaundice, swelling, being confused, severe fatigue, seek urgent medical advice. And then the following, guys, is important to know about. So all you need to know is in this slide. For more information, guys, will come. Yes, how to explain FIB4. FIB4 is a score we calculate using your blood test to check for your liver scarring or fibrosis. A low score is very reassuring. However, a high score means we may need further tests like a fibroscan and refer you to secondary care. Okay? So all you need to know here, if you need more information, guys, okay, you will find extra information here. So management of non-alcoholic fatty liver disease, usually as you know, guys, addressing the eyes, telling him diagnosis, face-to-face examination, explain what we will do. We will examine his abdomen, cardiovascular, BMI, blood pressure, all of that, because it could be part of metabolic syndrome. So what patient can do? There is no specific drug treatment to treat non-alcoholic fatty liver disease. It's mainly lifestyle advice. So our aim is to reduce or delay the progression of non-alcoholic fatty liver disease to liver scarring. So it's mainly about diet, about exercise, weight loss, reduce alcohol, avoid smoking, all of this. Okay. Then general management, exclusion of other liver disease. That's why we are doing some other blood tests as well, liver screen, to make sure there's no any underlying liver problem. Okay, and confirm the diagnosis of non-alcoholic fatty liver disease only after excluding other liver disease. That's why we mentioned in the management, we need to run further investigations. Ensure low risk for advanced liver fibrosis. Usually we use FIB4, but it is not only FIB4. There is NFS, there is also ELF. We will come to this in the next slide. But FIB4 is very convenient. Just open, guys, your medical application on the website, put the numbers, I think about 4 or 5 questions, you put it, and then it will tell you if your patient at high risk of fibrosis or low risk of fibrosis. Manage associated conditions, definitely. Optimize the management for hypertension, dyslipidemia, diabetes, all of this. Continue statin if already prescribed. Okay. If they are already taking statin, continue statin. Patient support from British Liver Trust or any charities or patient info if you would like to read more information. Drug treatment, usually under secondary care, and it is off license. Just in case if the patient will ask you, is there any medication? Usually no medication. But sometimes secondary care can give you some medications, for example, pioglitazone, sometimes also vitamin E, sometimes also vitamin E. Investigations, we mentioned about investigations. Here are the basic investigations that you need to do. Not only basic, just what are the full panel of investigations in terms of fatty liver. Usually we start with basic stuff, focal count, liver function, lipid profile, HbA1c. Okay, autoimmune screen, hepatitis screen, HIV is also some of the investigations to rule out different reasons for abnormal liver function. FIB-4 score, yes, we calculate the FIB-4 score. We also calculate SQ risk. If your patient didn't have ultrasound, you need to do ultrasound scan. If in the case scenario we didn't have ultrasound done, yes, one of the options will arrange ultrasound scan. The screening for advanced liver fibrosis is very important. Okay, non-invasive scoring system. We mentioned about FIB-4 because it is very convenient, but there is also NFS, non-alcoholic fatty liver fibrosis score, or there's also enhanced liver fibrosis test. All of these guys can assess how likely is having fibrosis. Is it high likely or less likely your patient is having fibrosis? If the patient is at high risk of advanced liver fibrosis, we need to refer him to secondary care hepatologist because they need further assessment and management. If the patient is at low risk of advanced liver fibrosis, we can take over. We need to follow up with this patient every year, at least every year. Refer to hepatology, you can read about the referral criteria. For example, if he is having high risk of fibrosis, as we mentioned, signs of advanced liver disease, you are not sure about diagnosis. What they can do for him, they can do fibro scan for him or liver biopsy. Okay. Follow up in the primary care. Please don't forget annual review. If he is at low score of FIB-4, low fibrosis score, we can take over. We can manage him in the primary care. You will need annual follow-up. Annual follow-up, you risk annually, especially if he's not on a statin, blood pressure check, BMI check, assess for any signs of liver disease, advanced liver cirrhosis or advanced liver disease, annual blood test, HbA1c, lipid profile, LFTs, UNEs. Okay, reassess the risk of advanced liver fibrosis every 3 years at least by FIB score, and continue to manage the patient at low risk of advanced liver fibrosis in the primary care. At any point, if your patient will move from the low risk group to high risk group, you need to refer to hepatologist for further investigation and further management. Here is the British Liver Trust about non-alcoholic fatty liver disease. Even they have a free helpline to talk to a nurse if he's in need or if you would like more support or more information.